Emily Smith has a story to tell about how newborn screening could have helped get her son into treatment, effective treatment, a little bit more quickly. I was involved in this. I didn't know her when she came in. She was actually seen by our pulmonary doctors because this was a young child with nearly complete, but not actually complete deficiency of ADA adenosine deaminase, which is one of the most severe types of severe combined immunodeficiency. But it has been known for some time that some patients will have a little bit of this enzyme in their functional, and so they won't have as severe a course, and they may actually survive for a longer time, but they're generally very sick. And I think her child had been ill quite a long time before he came to UAB and saw the pulmonary doctors, and her alert pulmonologist sent a flow cytometry specimen where we analyzed the T and B cells, and her son's T cells were extremely low. So we immediately became concerned and ran the appropriate tests, and I think fortunately I think he's done quite well after he got into treatment. But Emily, would you like to come up and tell us a little bit about from how things went for you?
I'm just going to start off. I could probably tell a book about the whole experience, but I've tried to scale it down to 10 minutes. So, my name is Emily Smith. My husband and I, Mike, were married in July of 2011. We had our first and only child, Dawson Smith, on April 7th, 2012. He was and still is everything we dreamed of and more. He is our world, and he means everything to us, and we love him to death. He was a normal newborn. He weighed in at 8 pounds and 3 ounces. He was 20.5 inches long. His newborn screening tests at the time were all negative. The only problem he had at his birth was that he was a little jaundiced. It wasn't until he was 1.5 years that he was diagnosed with ADA-deficient SCID. We knew having a newborn would be a hard adjustment, but I don't think we were quite prepared for what the next couple of years would bring us. I'm about to tell you what we experienced, and I hope to paint you a picture of what it looked like before, what kind of treatment we had, what kind of medications that we used, and how he's doing today. So what did it look like before diagnosis? Starting at about 3 months of age, he started getting sick a lot. He always had upper respiratory infection. He would always run fever one day, the next day he would be fine. He always kept a cough. I remember him coughing all the time at night. Always had a runny nose. We tried Zyrtec, nothing helped. He always had bouts of vomiting, fever, diarrhea. He would have eye matting all the time. He had recurrent ear infections and eventually got bilateral PE tube placements. After the tube placements, he continued to have ear infections. They would just switch from one side to the other. He was on and off antibiotics, antibiotic ear drops, and he was also hospitalized for dehydration. When he was getting all the ear infections, we couldn't get him to eat, drink, or pee, so they had to admit him for that. We didn't think much about it at the time because he was a newborn. He was in daycare. I too had recurrent ear infections as a child with 2 placements, so at the time we just thought he's got to build his immune system up. At his 1-year checkup, it was time to get his 1-year shots. He got the MMR and the varicella shots, which these are both live vaccines. His little body wouldn't be able to handle these, but we didn't know it at this time. So our pediatrician gave us 1-year shots, and she was moving away, so we had to look for a new pediatrician, and we were in the process of looking for a new one when we started having major problems. He broke out into 2 different rashes, and then he broke out into the chicken pox. He was seen by 2 or 3 different pediatricians, and one of them became his new one. They said they thought it was from the MMR, and they thought that he got a mild case of the measles, mumps, and the chicken pox. After the chicken pox, he started getting really sick. He ran fever for 6 days. He wound up having pneumonia, anemia, leukocytopenia with possible leukemia. So we're from Meridian, Mississippi, so they sent us to a local children's hospital in Jackson where they ruled out leukemia and said they thought it was viral suppression of his immune system. So we came home, all his lab work normalized, and then so he went back to daycare. Over the next couple of months, he stayed sick. He developed thrush, C. diff, adenovirus, shingles, and another round of pneumonia. At this point, we were starting to get really worried. He started losing weight and had failure to thrive. I started to notice that he was breathing really fast. I would notice chest retractions when he'd breathe in. So people told me I was just overreacting, but I finally consulted the pediatrician. I said, I feel like he's having trouble to breathe. Although he was playful, he just looked like he was getting really skinny and having trouble to breathe. And she agreed. So that's when she decided to send us to the lung specialist, Dr. Macris at UAB. She thought he had interstitial lung disease, and she thought he had an immune deficiency, but she had already drawn a bunch of immune deficient labs, and all of them were normal, so she couldn't really identify which one it was. So we went and saw Dr. Macris, and then he scheduled us. He was going to just do a routine bronchoscopy to look down in his lungs. But then about a couple of days later, I received a phone call, and he said that we didn't need to wait till the routine bronch, that we needed to bring him on back to Children's Hospital because he thought that he had a lung infection that he couldn't fight off. So he was admitted, and they did the bronch the next day, and he said his lungs were just full of pus. He was positive for RSV, positive for Pseudomonas, and positive for yeast. So, of course, they put a PICC line in, started him on IV antibiotics and antifungals, and they did what they called an RSV tent. And I don't know if y'all have ever seen one of those, but that is gruesome to try to put a 1.5-year-old in. This is when we got the diagnosis. We met the wonderful team at UAB, and they gave us the news that he had ADA-deficient SCIDs. This was upsetting news, and it was not the news that we wanted to hear, but we knew what we were facing. We had an explanation for all that had been going on, and I wasn't crazy after all for worrying so much because I knew something wasn't right. So what happened after diagnosis? The next few weeks, it was just a whirlwind of emotions. We had a diagnosis, but we had to figure out what we were going to do next. We were presented with different options, like there's the ADA enzyme shot, there's the gene therapy that Dr. Atkins was talking about in his presentation, there's bone marrow transplant, but we had to choose the best one, and we had to make this decision. So this was a hard decision. All the options, they were like Greek to us at the time, so we tried to, what if we made the wrong decision? That was going through our heads. So we tried to learn everything we could about each option, and we prayed really hard for guidance. We decided that the bone marrow transplant was the best course of action for Dawson. After the decision was made to have the bone marrow transplant, the process began of finding a donor. But we had to get him well, so we stayed in the hospital for about 3 weeks and was treated to get him well, and then they did send him home on several medications to prevent him from getting sick. We were on medicines like Bactrim, Diflucan, acyclovir. They did start him on the ADA enzyme shot to help his immune system until they could coordinate the bone marrow transplant. Dawson did wind up having 2 bone marrow transplants. The first one didn't work. He started losing his graft, and his ADA enzyme fell below normal levels again. Although the process for each bone marrow transplant was the same, the experience was totally different. For the sake of time, I don't have time to tell you the whole process of the bone marrow transplant. So I've tried to kind of tell you what the difference was. For each transplant, we had to stay in the hospital for about 4 weeks, and then we had to stay in the Birmingham area for approximately 100 days post-transplant. They changed up a few things from the first transplant, like the chemo regimen and stuff like that, to help the second transplant be more successful. After the first transplant, Dawson had several problems. He had rashes on his forehead, hands, and fingers. He got C. diff. He had to get a different chemo to kill his B cells due to complications with the EBV virus. He became septic twice with E. coli on his central line, He even got shingles again before the second transplant. After the second transplant, he stayed pretty healthy with no major infections or problems that we didn't expect to happen. Medications, with both transplants, he had to have chemo to make room for his new bone marrow. This was followed by mouth sores, hair loss, and decreased appetite for an already picky eater. He was on anti-rejection medications like cyclosport, and there was one other one, I can't remember the name of it. They put him back on the Bactrim and diflucan and acyclovir and all that to keep him well till his immune system matured to the point where he could get off of those. He had monthly infusions of IVIG, again, until his marrows got mature enough that he didn't need that anymore. He had a few blood transfusions and a few platelet transfusions, but he didn't require much of those. He was on 2 feedings with Kia-Fed placement after both of them because he wouldn't eat. So they wanted to be sure he had enough calories to make his new bone marrow. He had a central line that we had to flush out every day and lock with heparin. So how did this affect our family? This process was hard and very trying at times. We were in and out of the doctor's office. We were in and out of the hospital for weeks at a time. We lived away from home for months at a time. We were socially isolated because Dawson could not be around large crowds. That meant no church, no shopping, no hanging out with friends. He could not be around his other children or cousins because the risk of getting sick was too great. Then you finally get your child well after you find out he's sick, but you have to watch him get sick again to give him a cure because the chemo does make him really sick. And all the while, he don't really understand why you're letting all these people do all these terrible things to him. It's scary to care for a line that's sticking out of your child's chest and a tube feeding going down their nose, and then feeding them tube feeding that you wouldn't even drink yourself. It was frequent trips to Birmingham for Meridian for doctor's visits. Sometimes it was almost weekly. We were away, my spouse and I was away from each other for a long time just because of work demands and us living in a different town. And it's kind of stressful on a somewhat new marriage, but I feel that it brought us closer together. There was lack of sleep, lots of sleepless nights, crying tears, worry, and lots of prayers prayed. There was a lot of calling into work and taking off work, which means less money and more doctor bills and more travel expenses. There was tons of calls to insurance companies because, you know, you have to fight insurance companies to get everything paid for. It was hard, it was stressful, and it was a roller coaster of emotions. Sometimes it just seemed like you were living in a blur. But today, he is 2 years post bone marrow transplant number 2. His immune system works. The only medication that he takes right now is Zyrtec and vitamins. He has no other medications, no other infusions. He does have developmental delays, communication and speech issues. He does repetitive movements and some toe walking. But medically, he is cured. His immune system works, and he has no side effects at this time that we can tell. He has started school, and our new focus now is getting him to where he needs to be developmentally. That's all I have.